Is depression just a trend? Is calling autumn blues depression really fair? Is it just a bad day or something much more serious? We all feel sad, exhausted, or unmotivated sometimes. But when this feeling doesn't go away and life starts to lose its meaning, it might be depression. And depression can be the thin line between life and final, ultimate step. Today, I'll help you understand how to tell the difference, why depression is so often misdiagnosed, how to support yourself and your loved ones, and what to do and what to avoid. This video could save your life or the life of someone close to you. What is the professional definition? Depression is a mood disorder characterized by a prolonged sense of sadness and a loss of interest in daily activities. Also known as major depression or clinical depression, it affects emotions, thinking, and behavior, often leading to various mental and physical health issues. How people describe depression. A person with depression is like a hamster in a plastic ball. It's hard to get yourself moving and move forward because it takes a lot of mental and physical energy. At the same time, you see the world through that ball in a blurry way, and you don't see the point of running or any clear goal ahead. So you just exist in that ball without purpose, and honestly, just like a hamster, the best thing to do seems to be simply going to sleep. It literally is a lack of emotion. Pure apathy. Nothing matters and nothing seems like it ever will. People with depression often withdraw from social interactions, lose interest in activities they once enjoyed, and struggle with low energy and motivation. They may have trouble concentrating, experience changes in sleep and appetite, and feel overwhelmed by even simple daily tasks. Many battle persistent feelings of sadness, guilt, or worthlessness, and some may even have thoughts of self-harm or suicide. Their reactions to positive events are often muted, and they may appear distant, exhausted, or emotionally numb. Don't call autumn blues depression. It's disrespectful to those who truly suffer from this illness. Feeling down during gloomy weather is normal, but depression is much more than just seasonal sadness. It's a serious mental health condition that affects every aspect of a person's life, often making even the simplest tasks feel impossible. Misusing the term can trivialize the struggles of those who battle depression daily and make it harder for them to be taken seriously. Let's be mindful of the words we use and show empathy for those who truly need support. In depression, mood reactivity is usually limited, meaning that comforting a person with depression is either impossible or very difficult, and sometimes it can even make them feel worse. They may feel misunderstood, helpless, or blame themselves even more. In contrast, ordinary, non-clinical sadness typically fades when a person's attention shifts to pleasant experiences or positive events. A smile on someone's face doesn't mean they're free from depression or problems. Many people struggling with depression become experts at hiding their pain behind a smile. They may laugh, socialize, and seem fine on the outside while battling deep emotional distress inside. This is often called smiling depression, a condition where someone appears happy but is actually suffering. Just because someone looks okay doesn't mean they are. But here's the dangerous part. If the thin facade of pretending finally breaks, it might be too late. The person may have already decided to take the ultimate step. That's why it's crucial to check in on our loved ones, even when they seem fine. Sometimes, the ones who smile the most are the ones who need help the most. Depression is not anyone's fault. It often affects intelligent, ambitious people, proving that mental illness doesn't discriminate. No two cases of depression look the same. Some people suffer in silence, putting on a smile in public while breaking down in private. Not everyone with depression will stay in bed all day or neglect personal hygiene. Many appear to function perfectly fine, going to work, socializing, and keeping up with daily responsibilities. Depression can also have specified root causes. Traumatic childhood experiences, early trauma can lead to later depression. Hormonal imbalances, changes during pregnancy, menopause, or thyroid issues can trigger depression. Lack of purpose, feeling aimless can lead to depressive thoughts. Unfavorable environment, difficult relationships, or lack of support can contribute to depression. Parenting mistakes, negative parenting styles can impact mental health. Excessive stress, poor stress management increases depression risk. Addictions, substance abuse can cause or exacerbate depression. Neurotransmitter changes. Deficiencies in serotonin and dopamine can lead to depression. Genetic factors. Family history of mood disorders can increase vulnerability. Lifestyle changes. Sudden life changes can cause stress and depression. Depression or bad mood. Sadness is usually short-lived, lasting a few hours or a day, while depressive mood disorders can persist for weeks or months. In depression, sadness is often accompanied by symptoms like insomnia, excessive sleepiness, slowed movements, loss of pleasure, anhedonia, appetite changes, excessive guilt, pessimism, ruminations, low self-esteem, anxiety, and hypochondriacal fears. These additional symptoms are rarely seen in regular sadness. In depression, mood reactivity is usually limited, making it difficult or impossible to comfort someone, sometimes even worsening their feelings. Regular sadness tends to subside when attention shifts to positive things. The mood drop in depression can be profound, sometimes leading patients to feel they've never experienced anything like it. Suicidal thoughts are also common in depression, but almost never occur with regular sadness. Depression can arise without any clear trigger, although it may also follow a traumatic event, while regular sadness usually results from identifiable issues. The intensity of sadness in depression is often disproportionate to the triggering event, unlike regular sadness, which is usually in line with the cause. Regular sadness typically does not significantly affect daily functioning, while depression can make even basic tasks, like work or family duties, extremely difficult or impossible. In deep depression, negative thoughts can distort the patient's perception of their situation, leading them to feel trapped or hopeless, even if their life circumstances are objectively good. Regular sadness, however, allows for a more realistic assessment of one's situation. How to help someone with depression? Help him or her get an appropriate professional depression therapy and treatment with good doctor. Use understanding, patience, and affection. Encourage him or her in some activities, but don't push this person to do something. Just be there for someone. I know it may sound really hard in many cases. It's not an easy task to tolerate someone's behavior when we know that there is no reason to feel sad. That's the way depression works. It just cancels every positivity for someone. Be the strong partner, brother, sister, son, daughter, and friend. It doesn't have to mean to be there for someone all day long. Sometimes this sentence is enough. Okay, I got you. Tell me if you need a hug. Don't give them 24/7 advices, because this can sometimes be interpreted as the depressed person is not smart enough to understand basic knowledge and logic. Another important thing is that you should treat this person normally. Don't say things that can make him or her get worse, like get help, or stop acting like this. Frustration is not the best way to deal with depression. Depression is not something a person can snap out of and choose to be happy right away. Bad things happen to good people, and they don't deserve to feel bad all the time for what was done to them.